I'm Dr. Pack, and I'm here with Debbie Yarborough. And Debbie, thanks for being here. Give me an idea about what your problem was when you first came to see me, and how long ago was that?
The problem started about a year before I came to you, and it was pain in the knee. It had gotten to the point where I could hardly walk.
Both knees, one knee?
One knee, the right knee.
The right knee.
I finally went to the orthopedic clinic. I had gotten a cortisone shot from my regular doctor. I went to the orthopedic clinic. They gave me another shot in the knee.
That's not fun, is it?
No. And then they also did x-rays, said I had a small amount of arthritis, then did an MRI after the cortisone shot did not give me any relief. Then
And they told you at that time that you had what?
I had arthritis.
Okay.
Arthritis in the knee.
Join the group.
And what it amounted to was when I left, they didn't know what to do, you know, anything else to do, because I couldn't get relief from what they were doing for me.
Sure.
I had taken a lot of ibuprofen and stuff like that.
So there wasn't much of an alternative except wait until it gets bad and then have a joint replacement.
Right, joint replacement.
And how much pain were you having when you came to see me in the right knee? Let's say 1 is no pain and 10 is the most pain on a 1 to 10 scale. Where were you before?
I was close to 10.
Okay. And what about your ability to function or walk or get around? How was that before you came to see me?
Walking was very painful. I could take ibuprofen and I could stand it a little while, but then even that, the only thing that I could get relief, the only way I could get relief was to sit down.
So your daily activities were limited to some extent.
Right.
Okay, and then we treated you, and how have you been feeling since we did the inserts for you?
Been doing much better as long as I do my exercises and as long as I'm wearing my inserts. My pain is like a 1 maybe.
Okay.
And we keep working on it.
And your ability to get around is different than it was before?
Oh yeah, much better. I mean, I can almost do everything I want to do. Yeah.
And what about pain medication or anti-inflammatory medications for arthritis? You're not taking?
No.
Not taking anything at all?
No.
Debbie's case is very interesting because it shows the power of some very simple conservative treatment and the effect it can have in decreasing symptoms in arthritis. You know, there's a big misconception that arthritis is mainly due to age and weight, and that's not really true. Debbie didn't lose any weight, and she certainly didn't get any younger to get the results she had. Debbie had a problem where she pronates. Her foot flattens or rolls in, especially on the right side, and when it does that, it puts pressure on the inside of her knee. When you decrease that pressure, when you more perfectly align the foot underneath the knee, you decrease the stress on that joint. In the couple of months after we've treated her, she said she basically went from a 10 to a 1 or almost no pain whatsoever. And as I say, she certainly didn't get any younger. And when she had the problem, her problem was mainly on the right side. And that's very often true with people with osteoarthritis of the knees or hips, is that one knee hurts at least first or before the other one, and sometimes that's the only joint that hurts. Again, you can't really say if my right knee hurts that it's older than the left, or that there's more weight on it. It's due to primarily abnormal function, abnormal alignment deteriorating the joint. So her case is very interesting because, again, she had a dramatic result in decreasing her symptoms and increasing her activity. It also illustrates what happens in doctors' offices, such as mine, across the country and really around the world on a daily basis. Patients come in with pain. The doctor says, well, let's take an x-ray, let's see what it looks like. They come back and say, yep, you've got a little bit of arthritis, we'll start you on some pain medication. When that doesn't work, perhaps some anti-inflammatories or something more serious. And there are some pretty profound side effects from these drugs. Pretty risky when you take it on a continuous basis. And if the pain increases, which it usually does, then you go to an orthopedic surgeon, as Debbie did. And after x-ray, more x-rays and MRIs, she's told, yes, it confirms the diagnosis, you do have arthritis. Not much we can do. When you wear it out, come back and we'll put a new joint in. It's too soon yet. Now think about it. if you had a tire on a car that was wearing out, and you went to a tire fella and said, you know what, this tire on my car is wearing out, I'd like to get it fixed before it completely goes. Don't worry about it, when it does, we'll sell you another one. You'd say, this guy's not, I need to find another mechanic. But in medicine, there's no real alternative. There's no other answer. You just wear the joint out and then you have it replaced, only to start the problems all over again, and that's important. Why? Because when you put a new joint in, you basically thought you went in because you got old and just wore the joint out. What actually happens is you went because you had a bent frame. Yes, you had a new tire put on your car, but you came out of surgery with a frame that's more bent than you started with. Why? Because the number one complication of joint replacement surgery is ending up with a leg longer or shorter than you started with. So indeed the process starts again, and in time that shiny new joint actually has to be replaced as well. That's not a very good scenario. A lot easier to put a custom-made insert in your foot and do as well, if not better. So in a short period of time, again 1 to 2 months since we treated her, she had this dramatic effect. She takes no pain medication, no anti-inflammatories, she's had no surgery, and basically we've given her the ability to have her life back. Again, this is a case that dramatically represents what's happening all over the world, and an easy solution to it. I do want to mention, I think it's important to say that this result may not be typical for every single patient. We can't promise this kind of results for everyone. But it does exemplify the powerful, profound effect that alignment has on decreasing stress on the joints.